I wanted to take a little bit of time today to look at trends that we're seeing in places with a bigger head start with Omicron. And I think we're at the point now where we can start to get at least a general idea of where we're going and what we might expect statewide. I will start with a caveat now that these are very rough estimates. And so there's a bit of wiggle room in all of it, but the trends seem to be pretty consistent. And I'm also going to make some assumptions about our trajectory being relatively similar to what we're seeing on the East Coast. And I'm not sure that's going to be the case because, again, our rates of full vaccination and especially boosting in the most vulnerable populations over the age of 60 is quite a bit lower than it is in places like New York and Massachusetts. So that probably portends that we're going to do worse. We'll talk about that when we get there. But this is what we're seeing here now in Europe, which I think gives us some pretty good indications of where they are. And so let's look at Denmark first. What I've done is gone back to the previous winter wave of last year to look at the ratio between the maximum number of patients diagnosed with COVID per day, which has been smoothed to a rolling average in, I think, all of these. And then comparing that to the peak of hospitalizations from COVID from that winter wave. And then looked at what's happening now with the Omicron wave in terms of the ratio of cases to hospitalizations. You remember that we've talked about for a while in the UK and in other places with the Delta wave, we've had this significant decoupling effect where the expected ratio of hospitalizations to cases has been quite different in the Delta wave in the UK, probably because of a significant rate of vaccination and boosting recently in the most vulnerable populations in these countries. And so we've seen a significant drop in proportional hospitalizations compared to case counts over the Delta wave in many areas of Europe where they've had high vaccination rates. And that is continuing and even widening with Omicron. So let's take a look at that phenomenon. So in Denmark, when you go back and look at the year one wave, their case count peaked at around 3,500. You can see on December 21st of 2020, their hospitalization peak happened a little over 10 days after that, where they had a peak of 950 COVID patients in the hospital. And if you remember, that gap of a week to 2 weeks has been pretty consistent when you have a relatively well-defined epidemic curve that doesn't have lots of ups and downs and plateaus. It's about a 1 to 2 week delay in terms of when you peak in cases and when you peak in hospitalizations. And that was the case here. It's a little over 10 days again between their case peak and hospitalization peak. So back in last year's wave, again, peaked cases of around 3,500 on December 21st, peaked hospitalizations on January 4th at about 950. So that was a ratio of 3.7. So 3.7 diagnosed community cases for every hospitalization that occurred. In this year's wave, what I've done is looked at the latest date for hospitalization data. That's January 4th. And then gone back 10 days for Denmark to look at what the case count was at that point in time, with the assumption that, again, the case to hospitalization time lag will probably hold consistent. And if you want to look at where the hospitalizations are coming from today, you need to look about 10 days in the past to understand what case counts were at that point to understand what that appropriate ratio is. And so if you look at hospitalizations and case counts, hospitalizations, the last day we have is January 4th. 10 days before that, the case count, you can see that that ratio is now significantly higher, 15.2 cases for every hospitalization, indicating that two things are having an effect compared to last year. One is Denmark now has lots of people vaccinated. They are one of the highest vaccinated countries in the world. So lots of people now have protection who didn't. And we have a virus with Omicron that appears to be on a person by person basis significantly less severe in terms of its ability to cause hospitalization, probably half to 2/3 less likely to cause hospitalization based on the data we've had now. So that ratio of 15.2 compared to the prior ratio of 3.7 gives you a decoupling factor of 4.1. That means compared to the previous wave, our hospitalization rate is 4.1 times lower than we would expect, right? So that's a decoupling factor, essentially 4 times lower than you would expect with previous ratios. Makes sense? And just because of the holidays and some of the reporting anomalies that occur, I went back before Christmas and calculated what the ratio was then. And you can see it's a little lower, but still pretty close. And that probably reflects potentially back before Christmas, Denmark was having a bit of a small Delta wave. And so you probably had a higher proportion of Delta cases that were accounted for there and higher severity. And so that actually probably makes sense. It kind of fits with a logical explanation of what's going on. Let's look at the UK. If you do the same calculations in the UK, their wave in winter of 2020-2021 had a ratio of 1.5 cases for every hospitalization. If you look at the most recent data from the Omicron wave, you can see that's now 6.5. And so a very similar decoupling factor in the UK, again, a very highly vaccinated population. So their decoupling factor is about 4.3. So hospitalizations in the Omicron wave, a little over 4 times lower than you would expect if they kept the same proportion. Now I went back and also looked in November of what their hospitalization rate was for the Delta wave. That was before Omicron came onto the scene. So now just about everything in the UK is Omicron, certainly cases and probably now in the hospital. And for the Delta wave, you can see that their decoupling factor was a little lower, and that makes sense because again, the Delta is a more severe virus on a case-by-case basis, but you can still see that's still a pretty significant decoupling factor that they had back then, indicating that their vaccine protection is very good. Now, let's go look at states in the US and see where they are now, where I think we have enough data to start comparing. If you look at New York, New York has been one of the states on the leading edge of the Omicron wave here. You can see that their ratio last year at their prior peak was 1.6. And you remember the UK was 1.5 and Denmark was around that as well. I think they were 1.6. So actually Denmark was a little higher. But nevertheless, so New York, pretty close to what the UK was in terms of their prior patient to hospitalization ratio. You can see that on the Omicron wave, if you compare where the last data are for hospitalizations on the 6th, and compare 8 days before. And I do that just to be a bit conservative, so we're not overestimating the ratio. And also because if you look previously, their delay from peak to peak was 8 days and not 10. So we'll just go on the assumption that 8 days is a little more appropriate, and that's actually going to overestimate the coupling factor, but that's okay. We'll be conservative. And then if you look at that ratio, that's 3.5. So their decoupling factor in New York for the Omicron wave compared to prior is 2.3, significantly lower than the slightly above 4 that we've seen in the UK and in Denmark. And again, even though New York has a very high rate of vaccination, their boosting rate among the most vulnerable elderly is a little bit lower statewide than it is in the UK and Denmark. In New York City, I think it's actually pretty close, but in the rest of the state, it's much lower. Sorry, keep going backwards. Now let's look at New Jersey. The same thing is relatively similar in New Jersey. Their ratio, again, from the first wave was 1.6, exactly the same as what we saw in New York. Their ratio for the current Omicron wave is 3.8. So that gives them a decoupling factor of 2.4. So pretty close to what New York was and significantly lower from what we've seen in the UK and Denmark. Let's go to Massachusetts, another state that's been at the leading edge of the Omicron wave. You can see that their ratio in the year 1 wave is around 2.4. I had to play with the dates a little bit there because they have this weird kind of spike and wave plateau at the top of their case wave. So that week to 10-day phenomenon didn't necessarily hold when you look at the day-to-day data for them. I went with an 8-day gap just because I think still, if you looked at upward slopes, you'd probably still see that phenomenon. And I just didn't go back and do all of the calculations to confirm that, but I will go back and play with that just to make sure. But I think that's probably a safe assumption. So again, a ratio of 2.4 last year. This year, we're seeing a ratio of 3.1, so certainly better, but not that much better. So their decoupling factor is only 1.3 right now. Now, it's true that Massachusetts, I think, had kind of this confluence of a Delta wave, then followed by this Omicron. So it may be that there's still a number of Delta patients in the hospital that are overestimating their hospitalizations compared to current cases, and that decoupling factor may go up a bit. I expect it will, but I don't know that it's going to double or triple, right? So maybe they'll get to 2, but I'm not sure they're going to see much higher than that. Now let's go to Florida. Again, another state that's been on the leading edge, and a slightly lower I think boosting rate than those states in the Northeast, and a very similar situation here. Their decoupling factor has been 2.2 for the Omicron wave. So it looks as if in the US, our decoupling factor is going to be around 2 to a little higher, maybe a little lower compared to, if you look at Massachusetts, compared to what they're seeing in Europe, which is about a factor of 4. Now, again, these states on the East Coast have higher vaccination and higher boosting rates than many here in the Midwest, even more than ours. And in Nebraska, we are higher than most of our neighboring states. So I think a decoupling factor of 2 is probably an optimistic projection of where we're going to be. But let's assume that we're going to be somewhere around there and see what we can then expect in terms of hospitalizations in Nebraska. So if we look at states and places that are at the leading edge of the Omicron wave and appear to be at least close to peaking or peaking at this time, and again, you need to take into account that you may be saturating testing capacity at this point, as well as reporting systems, but it certainly looks as if their acceleration is slowing. These states are coming in with per capita case counts at around 300 to 350 cases per 100,000 per day, as you can see here. New York is the highest at 342, DC is the lowest at 301. So let's conservatively estimate that we're going to peak at around 300 cases per 100,000 per day. Understanding that this is not the true case count, it has to take into account the under-ascertainment factor, et cetera, et cetera. However, if we assume that we're going to be under-ascertaining at a similar rate, and that this rate just reflects in general the total population community attack rate, we'll go with this number as a simple way to estimate what we can expect. And so therefore, if we expect that 300 per 100,000 per day, we can expect a maximum case count here in Nebraska of about 5,700 cases per day. Now, if we go back and look at what we did in last year's wave in November of 2020, you can see that we had a ratio of 2.4 cases for every hospitalization for COVID. Now, if we are very conservative and think that we'll have a decoupling factor of 2.2, which is, again, I think higher than what we'll actually see. But again, we're trying to be relatively conservative and not overly alarmist about what we can expect. Then we can expect a case to hospitalization ratio of 5.3. So if we have a max of 5,700 cases per day at our peak, we can expect a maximum number of hospitalized patients to be 1,100, right? That's 5,700 divided by 5.3. Now, let's also add this incidental factor for correcting for the fact that if we have such large community burdens of 300 per 100,000 per day or more, we can expect a significant number of everybody walking around on the street is positive. Maybe 5 to 10% at the very peak would actually be positive for COVID PCR, either with active acute infection or recovering. And so we will again be very conservative and say that 30% of those hospitalized patients will not be hospitalized specifically because of COVID, but will be incidental hospitalizations. Then we can expect for COVID purposes or for the reasons of COVID illness, about 770, close to 800 hospitalizations will be our max for COVID at our peak. Again, this is, I think, a very conservative estimate. I expect will be higher, but it gives us a ballpark range of what to shoot for. Now, that may not sound too bad if you think of, well, essentially between 800 and 1,000 COVID hospitalizations is a conservative estimate of our peak. That's about where we were last year, right? So not so bad. But again, think about where we were in terms of overall hospital capacity in November of 2020 compared to where we are in hospital capacity in 2021. Dramatically different. We have no surge capacity right now in our hospitals compared to a very large amount of surge capacity that we had in November 2020. Also take into account that we're going to see, and we're already seeing, much larger rates of influenza hospitalization. Essentially, we saw none last year. And when I was on service last week, we had a few patients in with pneumonia, with influenza already. And so we're going to see that added burden on the hospital and health system in Nebraska. So even with this conservative estimate, I think it's hard to see how we're going to be able to absorb, 800 to 1,000 additional patients. As you can see from our count right now, we're at a little over 500, I think, for COVID hospitalizations across the state. If you double that count, that's going to put us in a pretty dire situation from the health system perspective. So that's a bit of a swag on what we might be seeing here in the next few weeks. Again, I think this is conservative. I think the true numbers will actually be higher, but it at least gives us a ballpark figure of where we should be looking.